COVID-19, how does it impact me and the practice of mentoring? Hello, I am Doug Lawrence and welcome to the practice of mentoring. I'm an international mentor and have my Certificate of Achievement Mentoring and my Certificate of Competence Mentor from the international mentoring community. I'm currently working on my Certificate of Competence Journey Mentor. The Journey Mentor certification will expand my practice to include mental health, mental well-being, and post-traumatic stress. Today, in episode number 5, I wanted to share with you how does COVID-19 impact me, and what are some of the things that mentoring can do in order to be able to alleviate some of that. So let's take a look at a couple things that can, in fact, be impacting us on a day-to-day basis as a result of COVID-19. So obviously, there's some direct health effects. So whether we are actually contracting or contracting is the best word to use, I guess, contracting the COVID-19 disease, and as a result of that, we are suffering from the symptoms, and even going beyond that, where we're actually, our body has been taken over by COVID-19 and we're experiencing all kinds of medical trauma and things that we had to deal with. But the thing that also is attached to that we a lot of times don't think about is that while all the frontline medical staff are dealing with those COVID-19 patients, what's also happening is there's a bit or in some cases a lot more reduced health services that were typically accustomed to being provided that can't be provided because of the frontline people who are doing an absolutely wonderful job of helping us navigate through COVID-19, but they can't do everything. And so that's some of the things that are dealing with. And so when I take a look at those two things, the role of the mentor in the mental health space as the mental health ally, and we'll talk about that in a little bit here, but is to be cognizant of all of those things that are going on and being able to listen and hear when someone has a story that they want to tell with regards to that. Something else that I've seen quite a bit this last little while, it has been the whole idea of when we have imposed lockdowns that we're having to deal with. So for most of us, it means not leaving the home, we're staying at home. Maybe one family member ventures out to be able to get supplies for the household and that. But for the most part, a large percentage of us stay locked down at home. And with that comes the feeling or the sensation of isolation. We've also seen where, and I've certainly seen this with my mentoring practice, where I've seen an increase in anxiety and stress because of having to deal with a number of different factors, and I'll touch on just a couple. But because of having to deal with those factors, our anxiety level, our stress level has increased. There's also the feeling of loneliness, and we don't think much about that, but I've actually got to witness firsthand where I facilitate a mentoring circle, and we've had to shift from in-person mentoring circle to one that is virtual. And as a result of that, the connection, the personal connection that people have has been taken away. And for obvious health reasons and all the, the right reasons, we have continued to stay true to delivering that mentoring circle in a virtual manner. But it has caused, for some people, some anxiety around the feeling of loneliness, because they were so accustomed to that Saturday morning and being able to socialize with a small group of individuals, and we've had to curtail that activity. What's also been really quite interesting for me in my research is that there has been an increase based on some of the reading I've done in gender-based violence as a result of the lockdown and the isolation. And when you start to think about it and kind of just clear your mind for a moment, that does make sense, where because of anxiety and stress and all of that, we may not be communicating as well. We may not be as respectful as what we possibly could be with those that are around us. So typically immediate family members and stuff like that. The other thing that I know from the whole lockdown isolation piece too, and I've seen this with some families, and it's in kind of different magnitudes, but is the idea of being told that you can, or not that you can, but that you will work from home. And in the case of a husband and wife team, or a significant other, um, you have to share workspace now in your own home. So you've got to carve out your own little space. I know I work off the dining room table. I'm fortunate that I'm the only one that has to work off the dining room table, unless we have company coming for supper or something like that. And then, we have to be able to deal with that. But that's another factor that is included in there, is having to share workspace at home. And, wanting to have a Zoom chat where there's background noise, or you're both trying to set up a meeting by Zoom or however, and you get the overlap, and the noise filters in through all of that adds to the anxiety and the stress. And then you compound that with what's soon going to be taking place, is that you also have the at-home children who require schooling. So the parenting part, the schooling part adds to that stress as well, because we normally don't have to deal with that. Something else that was actually quite interesting for me, and I've taken a couple of courses, and I actually have another one coming up here at the end of August to deal um, with mental health and some of the aspects of it. But what they had said was, as the COVID continues to grow, that obviously, the economy is going to suffer, and that we'll end up in a state, if we're not there already, a state of recession, where unemployment obviously is going to increase. But what also, sadly, is that suicide will also increase with that increase of unemployment as well. So lots going on there. There's lots of things for us to consider about. But the one thing that I want us to now start to think about from a more positive aspect is the aspect of a mentor acting as a mental health ally. And what I've heard over and over again, and I'm working with some folks that are struggling with post-traumatic stress, and the one thing that stands out over and over again that they thank me for is being that person who can listen and hear what they're saying. And yes, I too have gone through post-traumatic stress, and have come out the other side, certainly not a lot wiser, a lot stronger. But I had a strong support group. I had people that would listen and hear what I was saying. I would have people that were acting as my mental health ally, and probably did so without realizing that that's what they were actually doing. So I want us to start to think about, anytime somebody starts talking to you about mentoring, we also want to think about it from the aspect of that mentor being that mental health ally that we so sorely need in today's world. If there was ever a time where we needed it, now's the time for that to take place. And so an article that I had read was dealing with situations in Europe. And one of the comments that stood out that I wanted to share with you today, just as we come to a close here, was that the psychological toll is still very poorly understood. So things are going to probably get worse before they get better. And so what better place for us to have that mental health ally, that mentor acting as that mental health ally, what better place than today? We need to be able to do that. And I want to just acknowledge McKinsey and Company were the authors of the article with regards to the status of things in Europe. And I want to thank them for that. And so this was episode 5. I hope you'll come back and join us for episode 6. And in the meantime, make every moment a mentoring moment. Have a great day.